Prior to coming to the department, I worked with health services. I was the Executive Director of Nursing at Southern Health and concurrently held a number of other roles. So most recently with that was as the Operations Director for two of the sites at Southern Health, and they primarily focused on maternity services, surgery, cancer and community care. And I'd also held responsibility for general medicine and the programs of rehabilitation and aged care across Southern Health. Before that, I'd worked in mental health, and my clinical background is in mental health. We're talking about better student placement coordination because we have a terrific problem in Victoria at the moment. Our problem is that we've greatly increased the number of students in Victoria. And without an increased number of graduates, we don't have a viable workforce into the future. But without really good clinical preparation, we will have graduates that are likely to struggle, and we will have less well prepared graduates. We need to make sure that we're doing everything we can to coordinate our clinical placements in the way that enables those students to develop not only for today's workforce but also the futures, and that makes absolutely the best use of our clinical placement capacity. We held a number of consultations across Victoria late last year and very strongly heard back some themes around the need to improve our capacity to coordinate clinical placement and our capacity to identify just where there was capacity that wasn't being picked up and fully utilised. This issue is really topical right now, and it's topical not only because of the increased number of students that we have in Victoria, but also because COAG, the Council of Australian Governments, recently announced a number of reforms and investments through the National Partnership Agreements, and the one that interests us today is the one that's around workforce enablers. As part of that agreement, COAG announced investments that will better coordinate overseas recruitment, investments to produce a national workforce data set, some investment in workforce redesign initiatives, and also some financial support for supervision and a new approach and extra money for clinical placements. And that one's particularly is just so exciting because not only is it extra money in the system, but it is also a new way of providing that money. The money will now follow the student, and that's the first time that's happened. Well, even before the COAG initiatives were announced, we knew that we wanted to support a change in the way we approached clinical placements. We wanted to improve the coordination of clinical placements, but also enable some different considerations and probably a more planned and purposeful approach to a student's clinical placement throughout the life of their undergraduate preparation. We had heard from those consultations that I'd mentioned earlier that local partnerships between health and education providers are critical to good placements. We also know that our priorities for future health demand is going to change, so we're going to be looking more at chronic disease management, early prevention, early intervention, new models of care, interdisciplinary learning, things that flag really different ways of operating. And if we're going to position our students to be able to work in those different ways, then we need to think about a different approach to clinical placements. So we were already thinking about trying to establish and support local networks that would drive clinical placements, but we were confronted with a very significant problem in terms of how do we make the funding equitable? How do we get funding across that broader range of clinical settings, across the private sector, the community sector, aged care providers, GPs? How do we get all of those players engaged and provide some support and make it equitable? This COAG announcement remedies that. This COAG announcement gives us a fantastic opportunity because, as I'd said, the money will follow the student. So we can take a truly system approach to this. If we think about clinical placements and their coordination and start to think whose problem is it, we have to come up with the answer that it's everybody's problem. We are all future consumers, potentially, of our health and community services. And I don't know about you, but I sure as heck want to have a really good, really well prepared and very appropriate workforce providing the services I need if and when I need them. I think that clinicians have an even bigger investment in this because poorly prepared students end up being poorly prepared clinicians. And poorly prepared clinicians, I think, either seek to hide their inadequacy, or they learn on the job, or they feel so stressed that they leave. Any of those outcomes is a really bad thing for our clinicians and adds to their stress, as well as making it far less likely that we can meet the needs of our community into the future. So it's everybody's problem. We all need to be involved in the solutions around this. We know that anything this important doesn't really happen unless it's a team effort. So unless we all get engaged in this process, unless we're all part of the planning of coordinating clinical placements, we won't get the workforce of the future that we won't get that sort of workforce that we all want to be there if and when we ever need services. So if we come together and have around the table people from all parts of our health system, looking at what makes the right kind of pathway for a student throughout their preparation in terms of their clinical placement, we will have a very purposeful approach to each and every clinical placement. We will have opportunities for each part of the health service to showcase to students what they can offer them and why they would want to come and work in that part of the industry. We will help students understand this is a whole career, that you don't need to leave health and community services to have a change. You can have 10 careers within health and community services, and they will have had a chance to have tasted that across their clinical preparation if we plan this properly, if we take a systems approach, if we do it together, and if we do it well. We will have a workforce that we will be proud of and that we will really know, we'll feel confident in if ever we need services into the future, and we'll keep them. They'll want to work with us.